What is hyperacusis and how is it treated? Have you ever experienced discomfort from everyday sounds that seem unbearably loud? This condition is known as hyperacusis. Hyperacusis is characterized by an increased sensitivity to sounds, making them feel uncomfortably loud or even painful. This heightened sensitivity can affect one or both ears and can significantly impact daily life. People with hyperacusis may find common sounds, like running water or clanging dishes, distressing. This can lead to social withdrawal, anxiety, and stress, as some individuals may develop phonophobia, a fear of noise, causing them to avoid public situations. Hyperacusis can develop suddenly or gradually and is more common in adults, especially those who also experience tinnitus, which is a ringing in the ears. However, it can also affect children. The condition is not usually congenital but can arise from various causes. These include ear damage from medications or toxins, head injuries, viral infections affecting the facial nerve or inner ear, neurologic disorders, temporomandibular joint syndrome, and exposure to sudden loud noises or prolonged loud noise without hearing protection. There are different forms of hyperacusis. Cochlear hyperacusis causes ear pain and intolerance to everyday sounds, while vestibular hyperacusis can lead to symptoms like dizziness and nausea. Diagnosis typically involves a thorough physical examination and hearing tests conducted by an audiologist. Interestingly, many people with hyperacusis may not show measurable hearing loss on standard hearing tests, but might struggle to hear speech in noisy environments. When it comes to treatment, the focus is on managing symptoms and improving sound tolerance rather than curing the condition. One common approach is sound therapy, which involves gradual exposure to low-level sounds to help desensitize the auditory system. Counseling and cognitive behavioral therapy can also be beneficial, as they help address anxiety and stress related to sound sensitivity. Selective use of hearing protection can be helpful, but overusing earplugs can worsen sensitivity by increasing auditory deprivation. It is also important to treat any underlying conditions, such as temporomandibular joint disorders or infections. While medications may be used to manage associated symptoms like anxiety or migraines, there is no specific drug that cures hyperacusis. Since hyperacusis can vary widely in severity and cause, treatment plans should be personalized and guided by healthcare professionals who specialize in hearing disorders. Early intervention can improve quality of life and reduce the risk of social isolation and psychological distress. In summary, hyperacusis is a complex hearing disorder involving increased sensitivity to everyday sounds that can lead to discomfort and social challenges. It is diagnosed through clinical evaluation and hearing assessments, and treated primarily through sound therapy, counseling, and addressing underlying conditions, focusing on improving sound tolerance and psychological well-being. If you suspect you have hyperacusis, consulting a healthcare professional is essential for proper guidance and support.